from the infectious disease specialist at Barnes Jewish Hospital is we cannot let down our guard when it comes to the measures that we have taken so far to keep the COVID-19 numbers down. News 4's Ray Preston has been speaking with healthcare experts. Joins us live this afternoon from South St. Louis.
Well, News 4 viewers had questions ranging from can my pet spread COVID-19 to questions about wearing masks. We put those questions to Dr. Steve Lawrence.
As long as we continue doing what St. Louis has done well and historically and what they're doing well right now, we may be able to escape the worst of this.
Dr. Steve Lawrence says St. Louis must continue the fight. One viewer wanted to know if you could get COVID-19 from the family pet.
It's been demonstrated some animals can actually be infected with the virus, but there's really been no evidence that people have been infected from animals and that it is not at this point considered to be a significant risk.
When it comes to wearing masks in public, many people have taken the advice and cover their mouth and nose with an N95 or homemade mask, but others are choosing not to cover up.
Some people may have a coronavirus infection and not know it because of having few, if any, symptoms. And so the best strategy of all for people to avoid being infected is to avoid being within 6 feet of other people. I think our health departments have a very good phrase that describes this, and it says, "My mask protects you, your mask protects me."
For those who may be showing symptoms and do not have a primary care physician or family doctor, Lawrence says reach out to the hotlines from area health departments. In the meantime, stay home and do not go out in public. And even if the number of cases slows down, the advice is don't let down your guard. He says some of the measures taken to fight the pandemic might then be able to be relaxed, but that can't be all at once or too quickly, or we risk it bouncing right back.
I think what's very important for your viewers, for all of us, is that we are seeing real evidence that these measures are working, and to really reinforce that that is a call to remain vigilant, stay strong, and keep holding on. We'll get through this, and it just, we need to maintain this very intense effort for just a little while longer.
He says he does anticipate that we will see coronavirus infections beyond the current wave. Now, just when and to what extent, he says, depends in part on just how successful and when a vaccine will be available. Some projections are that would be fall of 2021. Now, we all know about the lack of ventilators around the country and what a desperate need there is. Well, one St. Louis doctor is trying to help solve that problem. We'll have that story coming up at 5. Reporting live in South St. Louis, Ray Preston, News 4.